Gold participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC here for Gold Learning. And here at Gold, our preparations for the upcoming Gold Lactation Online Conference are in full swing here. It's just around the corner at the end of this month here in March. And before every conference, what we like doing here at Gold, we like to check in with our speakers. So you, our listeners, are able to meet them, get to know them a little bit. We're going to talk about their work and a little bit about the presentation. So with me today here is Dr. Rojjanasrirat. Welcome, Dr. Vilay.
Hello there. How are you?
Oh, how are you doing? It's lovely to
Good.
have you here.
It's a lovely day in Kansas.
Oh, it is. It is. It is. And it's so
Spring
you
is
are in
coming.
Kansas today.
Yes.
That's where you are. Wonderful. What's the weather like?
Oh, right now it's like about 60 degrees, so we're very happy for a change rather than
Mm,
like in 20 or 30 degree
right. So it's a
Fahrenheit.
little spring-like today, right?
Yes, yes, yes.
And we were chatting earlier on. It was just your birthday, so happy birthday from us here from Gold.
Well, thank you.
So
Thank
thank
you
you
very
so.
much.
Oh, you're welcome. Thank you so much for being here with us today. It's lovely to have you. And so we want to introduce you a little bit to our listeners here. So tell us a little bit. We know you're in Kansas, and we know you're a professor, right? So tell us a little bit about your work and your background here.
Yes, happy to do that. I'm currently a professor of nursing at school of at Graceland University. It's a private Christian private university that located in Independence, Missouri, and so I've been teaching on basically online, the
Hmm.
graduate program. So it's master's degree in nursing and a doctoral nursing
Mm,
practice. So I've been teaching at this university for about 10 years now. So
mhm.
my courses is mostly on research or evidence-based practice or biostats. So those are subjects that am currently teaching and strictly online. And the platform I use is called Brightspace. So it's very similar to
Hmm.
what I'm doing with Go Lactation right now. So, but I've been in the nursing profession over almost all my life, 36 years as a nurse. I was nursing midwife in Thailand too,
Oh.
but I practice as a, for my clinical nursing, I work in labor and delivery, I work in nursery and mother babies, and as a lactation consultant right now, I'm currently work a little bit, on as a less than part-time, but just to keep all my lactation skills going.
Yes,
So
your
yeah.
lactation skills going. Well, thank you for sharing that. Wonderful. So many years you worked in the field. You were a nurse, a midwife. Love
Yeah.
this in Thailand. Beautiful. So you were catching babies and you're working with moms and babies for a long career. So how did you switch into academia then?
Well, when I finished my doctoral degree in 2020, I mean, not in year 2000,
Mm-hmm.
and that's how I got involved because I love research. When I
Hmm.
was during my doctoral student program, I
Yes.
was involved with all my advisor, projects and stuff. So I really fall in love with research activities, and then got my own research in.
Hmm.
That's what my focus on the dissertation is, maternal employment. So I was doing a lot of pieces, of my research is focused on maternal employment. I had a book chapter also that actually just came out a few months ago. That's a lactation book, that most of the IBCLC or some of the that they use for
Hmm.
taking the course, taking the exam, you know. So that was one of the books that
Right.
that a lot of health providers
Uh-huh.
they tend to use that to prepare themselves for test.
And what chapter is that?
I believe it's chapter 18, 17, 18, something like that. It's all maternal employment. Uh-huh.
Maternal employment. That is and that's your
Exactly.
field of research.
Ye-
Wonderful, wonderful.
Yeah.
That's great. That's good to know. So any of our IBCLCs out here, look for that chapter in the book, and that's by Dr. Ulai. That's
Thank you.
wonderful. So now you're teaching online, which is great. It's fantastic. It's wonderful that we can do that nowadays, right? We don't, and especially nursing students, they're still out working in the field if they're getting a master's or doctoral degree, and so that allows them to be, to be able to continue their learning journey. Online is a great platform, and you're teaching on research, right? On everything research related. Um,
Right, right.
so when you talk to your students, what do you see they struggle the most with, if I can say that struggle? I don't know. What do you see that is most difficult for them in that field?
I think research is kind of, is the area that people tend to feel like intimidating when they're
Yeah.
talking about it because
Yes.
it's unfamiliar terms, a
Hmm.
lot of concepts and terminologies. It's
Yes.
almost like a new language. So they're not quite, sometimes it's almost like you relearn the new language,
Mm.
and some of the analytical, like statistics and stuff like that, when you read the research articles, that's what they tend to have problems the most, that they not quite understand how to
Hmm.
interpret, some of the significant testings that they use in each research. So I think
Hmm.
that's what most people that I have heard, that they don't feel like, something that they understand, that,
Right.
so that's what turned them off. A
Right.
lot of them might like some jargon, some words that they're not familiar with and didn't make much
Hmm.
sense. Yeah.
Uh, that makes a lot of sense. Yeah, it can be kind of overwhelming and daunting to think of, the topic of research there as well, and exciting too. I think, and I want to ask you if you agree on this. I think we live in exciting times regarding research, right?
Hmm.
Especially regarding human milk and breastfeeding.
Uh-huh.
I don't know if it's me or if we're seeing a lot more research and finally the topic gets the attention it deserves. Would you say that, or is it just in because we're having more access to research through the internet now? What do you see in the field?
I feel that it's such a very essential,
Hmm.
actually, because every day everything's nowadays is based on evidence, right?
Yeah, yeah,
So all the protocols, all the new guidelines, new practice guidelines, everything has to be based on the evidence, which means that it's based on research being done, what
yeah,
directors us, and how we share information to our patients, to our
yes.
breastfeeding mothers, and whoever we contact with, and all that. So we always look into like up to date, or some of the
Mm,
tools that we use to how we can get or access information easily. Some of that program like up to date, some of my nurse practitioner students tend to use it because it's already been uh, digest, like make it
mm,
into
mm,
a common language, rather than all the jargon words or jargon terms or all the hard statistics and stuff
hmm.
like that. People
Yeah,
don't like that.
yeah,
So that's make it a little bit more friendly for people to just like, oh, okay, this medication versus that,
right.
so people have understanding and have options
Hmm.
to actually do, something like for depression mothers,
Right.
what kind of drugs or what kinds of thing that actually okay or not okay if I
Hmm.
continue to breastfeed, for example.
Absolutely. And yeah, it's more easier to digest than the information, right? Um,
Hmm.
let me ask you this. I mean, especially now with social media, right? I mean, we probably out there in the field, we get a lot of questions from, our families, or we stumble across any articles on social media ourselves. And I must say, I've seen some things posted on social media that look pretty sophisticated, and we have to look when I look into it and I dig deeper, I see this is really not a research piece. It's like something that is disguised as research, and often it takes like even bits and pieces, graphs, statistics, and so on, and it's really difficult to see what is actually real and what is just posted because there's a deeper, there's some hidden agenda with that. What do you say to this?
Yeah, you made such a good point about that, that it's very difficult with now that, when you Google it,
Yeah.
everything like thousands and thousands of information are out there.
Mm,
But which one is to believe in
right.
or trust it most in
Mm,
terms of resources? And that's what research is all about. When we talk about evidence-based class, that's how I tell my students about how you can identify,
mm,
the false information or something to be actually chosen for the scholarly paper or
mhm,
something to really believe in and
mhm,
and use that resource to actually write your paper on and that's one of the topics or areas that I always pointed out that
mhm,
which of the databases or
right.
what websites or how would you know that which one should be more rigorous
Right.
that could be more valid area or information to or rely on
Yeah.
something like that. So
Yeah.
a lot of time when you read the newsletters or media,
Yeah.
you always looking into the sources,
Right.
where that come from. You need to really kind of check back about validating the
Mhm,
information, where they cite information, what are the
mhm.
references,
Yeah.
are these from private lab somewhere or from the
Right.
pharmaceutical companies or from
Yeah.
the formula
Yes.
companies or
Yeah.
who
Yeah.
actually they have any stakes kind of
Yes.
benefits or something like that. So just kind of
Yeah.
have all that information in
Ab
mind about when you read information out there, especially in the social media, like you said.
Absolutely. Yeah. Absolutely. So important. And, it's great nowadays that we have access to so much information. We can look up articles and we can look up journals and such.
Hmm.
A few years back when you were working in the field and you wanted some research, you had to either subscribe to a paper and journal or be part of an organization or a that had subscription or be in a university as such. So that is wonderful that we have that access now to all that great information and research and
Hmm.
evidence-based information. But on the other hand, we have to be really diligent to see what's out there, what is really is that really good valid research, or as you mentioned, is there maybe a company behind that has an agenda, right?
Yeah,
Yeah.
yeah.
uh,
So yeah, this information I also included in my presentation.
Beautiful. Beautiful. That was my next question, actually, to tell us a little bit about what your presentation is going to be about. And it's titled Understanding Lactation-Related Research. And that's such a wonderful topic. I mean, that really is. And we only have an hour with you. You probably could talk for hours on the topic. So just give us a little brief overview of what you're going to be presenting there. And also maybe what you're hoping our delegates will take away from it.
Sure. Yeah, because of I think that this is the era that evidence-based is so important that we always wanted to rely our practice on the research information, something rigorous, something to be
Yeah.
very valid and reliable for on. So, so I think information that I'm trying to present here is how we know, how we can read the articles and extract some of the information to be used that this is something that actually, to present it to our clients, to our colleagues, something that we can improve our practice, or some of them that we can continue to like identify certain issues or problems, and we wanted to be able to implement something to do that in our setting, to improve practice. So my information my presentation would be including some pretty much just like a real foundation, real basic
Mm,
information, how you identify research versus quality improvement project, how you identify some of the resources out there, how you be able to, identify uh, different kind of study designs, which one is
mhm,
better than the other, the experimental versus non-experimental studies or survey or,
mhm.
so in that way, what is the systematic review, what is the meta-analysis. So some of this information that you usually trying to, make sense out of the information that they're trying to, research taking lots of time. When they're
Mhm.
trying to
Yeah.
do a systematic review or meta-analysis, they take months. okay, if
Absolutely.
not more,
More.
um, to to gather all the research information for you to be able to use in practice. So that's the focus. That's what I am trying to present to you, that, what are the information out there and how we can identify them, how can differentiate them from good and bad or poor,
Hmm.
when you look into the research. So I would present you to, like, maybe some steps about the evidence-based practice, uh, uh, steps, but not really able to get in depth about it. But at
Hmm.
least be telling you, and maybe show you how to even when you pick up the articles, what is it that is worth your time in reading the entire article. So there are steps like that that I like to share with you, how you can get information out of the articles, and without having to feel that, like, which one I should use or which one I should not. So there's steps like that that I was trying to share with you.
Wonderful. Thank you so much. This sounds like a fantastic presentation. I can't wait. And that you are able to explain research to us. We get the foundations and we also learn how to implement that and take the knowledge then from the research and, into our practice and share with our clients as well. That sounds absolutely fabulous.
So are there any specific you know questions that people would be looking forward to mostly, with
And yeah, and you know what? This is what we want to encourage our listeners. So I want to tell our listeners here that the presentation is, of course, part of the Gold Lactation Online Conference of 2020, and the presentation will be live on April 21st. So if you come to the presentation, if you register for the conference, you will have access to ask questions during the live presentation, and of course also we have forums where you can place those questions in. So there would be a good way to for our listeners to post your questions to our speaker
Sure.
here, and you will be and Vilay, you will have a chance to answer all those fantastic questions that will be coming
Excellent.
in.
Yeah, I look
Excellent.
forward to it.
Wonderful. So thank you so much for chatting here with us today, and we're looking forward to your presentation.
Well, thank you for having me.
An absolute pleasure. And for our listeners, one more time, the presentation is live, going to be live on April 21st. And of course, as part of the Gold Lactation Online Conference, we will have over 28 hours of accredited hours there for you this year. It's the 14th year of this fantastic conference. And this year also we have added workshops and panels and ask the speaker interactive sessions. So it will be a fully interactive event. And to find out more about Relay's presentation and about all the other presentations in the conference, we would like to invite you to visit goldlactation.com. Thank you, everyone, for listening, and I hope I see you at the conference. Bye bye, everyone.